Hi everybody, I'm Susan Collini and welcome to today's Roundtable. And since we are in March, for those of you that know, this is Ash Wednesday. So this is the beginning of Lent for anybody that is religious. And the other thing that we're talking about today, that's just a little sidebar, but our tagline was "Kiss Me, I'm Irish, lips, lips, lips." So we know that pretty soon we'll be celebrating St. Patrick's Day. So we thought we would take a little advantage and wear a little green. Of course, she didn't get the memo. Lori didn't get the memo. So anyway, so we're going to talk about that today, about lots of things about lips. And we thought it was very cute. So I'm going to tell Sarah to come on in because she's being our videographer today to make sure that we're all on cue. And she had a little green on too, so we have to do that. So welcome back, Sarah. She's been MIA. She was out on maternity leave, so we have a new little addition to our crew, Luca. So that's exciting. So I'm just going to go around for those of you that don't know our team. To your left, to my right is Lori. Lori is one of our laser estheticians, and she works very closely with Derek. And you notice that Derek and Ronnie are missing today, so we have girls flanking my right. And they're on vacation, so I hope they're watching. Hi, guys. Well, they're probably not. They're skiing. Anyway, and then, of course, this is Sarah, and Sarah's welcoming back. She's our Age of Innocence manager, and she keeps us all organized. And then to my left, your right, we have Marley, our physician assistant, who does a lot of the medical information that we talk about. And then, of course, our Ashley, who's our esthetician, who's also now in nursing school. So we've got the little variety of different things that Ashley can fill in with. And, of course, this is a hot topic for her. So we've really glad that she was able to come on board and join the Roundtable for a while. So that's really great. So the very first thing I want to talk about, we want to get the stuff that's not so fun, because I think everybody tunes into us for fun and learning about feeling good and looking good. But the first thing about lips is that we can do some reconstruction. And reconstruction is what I'm talking about, not changing the lip for cosmetic reasons, but let's just say you get hit in the lip and you need your lip sutured. You have a dog bite, we've gotten those. If you have cancer, if there's something unusual about the lip, these are all things that you really, when you're talking about the lips, you really would like to see a plastic surgeon, because this outside ring of your lip is called the vermilion border, and if that gets cut in any way, if that's the site of a reconstruction, you really want to make sure that that area is melded together properly, because if it isn't, it causes a very disfiguring kind of look to the lip.
If the vermilion border is lined up, even just not lined up correctly, even just a millimeter off, it's noticeable to just a casual observer. So that's, it is really important if you have some kind of injury. A lot of times we see lots of kids that fall, their tooth goes through their lip and there's a laceration on the inside of the lip. We can take care of that too. So yeah, I would say, like you said, plastic surgeon for anything with the lips is really important.
Right.
And glue is not, we see a lot of people that have their lips glued from other places, and that just never ever heals well, ever. So somebody's trying to glue your lip, come here.
Right. That being said, we should get that out of the way. So if you have a problem, definitely you want to see a plastic surgeon. There really isn't anybody else that I would recommend to suturing lips other than a plastic surgeon.
Yeah.
And so come here, we're always available.
Yes.
Anyway, on that note, we're going to get into the fun stuff now and start getting into the cosmetic part of lips that most people tune in for. The very first thing about cosmetic lips, people are always looking to change their lip, either size, volume, shape, different things. So that's what we deal with every day. And there's some other things involving the lip that we're going to talk about along the way. But the very first thing is, the easiest thing if you're talking about filling your lip is getting a lip plumper. So we have our great lip plumper displayed, and it really is a great lip plumper. There are a lot of them out there on the market, but this has an SPF in it, and it has some other antioxidants and different things that are really good for the lip and help rejuvenate the lips themselves, because they can get wrinkled and they can look atrocious, so you want to be able to do that. So I know that so many people love that. So we're having a special always. You know, when we mention them, we do have a special. So come in and try it. You'll really love the product.
It's
really good stuff.
Always have it on me.
Yes, I did not put any on today because I wanted to make sure that I was enunciating everything correctly and not too plump today. So that's the very first thing. So that's what anybody can do without doing anything surgical intervention or filler intervention or anything, is just doing a great lip product that you might find to give you just a little bit of extra volume in the lip, and that's a great thing. So now when you're looking for more, the best thing or the quickest thing that most people are looking for now are fillers. So the type of filler that we use, we don't recommend any other types of fillers other than hyaluronic acids. So every company has some form of a hyaluronic acid. So your Juvederms, your Restylans, your RHAs, those are all hyaluronic acids. And I'm going to let Marley talk for a second about hyaluronic acids and what they do, and I'll jump in if she's not remembering something that I remember, so we play a good tag team.
Right, so all the hyaluronic acid fillers, there's different ratings on how soft or hard they'll be based on how much water they absorb. So in the lips, we typically use a hyaluronic acid that's softer because we want it to, whereas if we were filling the cheekbones, we would use something that's
more
harder.
viscous, right?
So so with the lips, we would use something softer so it absorbs more water. And then it's more natural. So, and then the lip filler typically, it can last up to a year.
So yes, a lot of times they'll say a year to 2 years. Well, any of us that have gotten lip filler or we've used hyaluronic acids, we know that it's really a good 6 months, and then it starts to subside.
Yes.
You still have it, but it's not the same volume that you have. So it'll start dissipating. So it depends on how aggressive you want to be in order to maintain that balance of, full versus you'll still have it, but it's just not quite as full. But that's exactly what a hyaluronic acid does. It's not something that goes in real thick. What it does is it combines with water. So people have mentioned to me, and I don't know if they've mentioned to any of you, that they'll say sometimes their lips are fuller than others, and based on what they're drinking, their hydration level. So your hydration level affects your lip filler or anything else that you have filled. So sometimes you'll look a little plumper than others, and it's based on, so if you're at the 6 month point of your hyaluronic acid, keep drinking water.
Drink your water.
This up. So that's something to know about hyaluronic acids. The other thing that I wanted to talk about that I notice as well, that people have different reasons for filling the lips. People that are young, like that, getting the volume in the lip, that Kardashian look, that the Russian doll look, the lip flip, all these different buzzwords that we hear about the lips have to do with getting volume. I notice though, a lot of times patients that are, older, they tend not to want bigger lips, but they want to address the loss of volume that they are having with age, and of course some lines in the vermilion border along the upper lip. So I always recommend the softest. If somebody has never had lip filler, you kind of gauge what they're looking for. Again, we go with the lesser. Lesser is more. You can always add. You can always make it firmer in the future. But if it's your first time, I always recommend a soft enhancement, because I think that if you go too aggressive and you're not used to it, and your friends aren't used to it, and your family if they're not used to it, then all of a sudden oh my gosh, what did you do, and all that type of thing. So I noticed when I started doing lip filler myself, now contrary to popular belief, I've not had any in 4 years, so I have naturally full lips to begin with. I know that that's always an issue with me. I've had Donald Duck lips in the past. I've been there with the Angelina Jolie lips, so I've had them, I've experienced them. But right now you see me with a no filler in my lips, so I've been there. But again, when I started doing that, I was younger. I was in my 30s, late 30s, early 40s, when it was very, very popular. And now as I'm older, if I were ever to consider filler, it would not be for volume. It would just be trying to address the small lines that I have in my upper lip, just to soften those out a bit. So that's what my goal would be. So depending on how much you use, most people do go through a whole vial with just their upper lip alone. You think you won't want a lot, but you need to address that. So we can dress just those soft lines and eradicate those. I shouldn't say eradicate them. You can't really eradicate lines completely. They're always there, but you can fill them in, soften the look.
And those smokers lines.
The smoker
a lot
lines.
Of people call them. And
Or straws. Straws give you the same. If I can tell anybody, even if you're not a smoker, don't drink out of straws because they give you the worst lines that you get. You know, they really aren't. They really aren't good. So they really give you lines.
Marionette lines. Like lines around here.
Right, so that happens in the face and the mouth, and your lips can age you as we age. As the cheeks start to subside, it actually turns in the lip underneath. So we start losing, that's why our lips don't look that full. They get smaller as and we get longer in the tooth, so to speak, where our lip starts to cover more of our teeth. We don't see that much of our teeth anymore when you're in a resting position, which ages you. So there are a lot of things that we're going to talk about in a few minutes other than just lip filler. So those are the different reasons that you can fill the lip, and you can do it in different shapes. So you can just give a very even distribution of the filler so that you get an overall plumping. I know that I'm going to toss this over to Ashley in a second. She likes the Russian doll look. So I'll let you talk about that Russian doll look, Ash.
So basically that's like one of the newer trends or that we're seeing, every couple years you have lips that are really, really full and wide, where this is the fullness, but it's basically focused towards the center. And I've noticed, and I'm sure you guys noticed too, certain face shapes, it actually suits it better. Like I kind of have smaller, like I have a small nose, like I have a smaller face, so wider lips on me kind of look a little weird, where now we kind of just focus the filler right in the middle on the top and right in the bottom, and I think it just creates like that really cute, like perfect little shape to the lips depending on your face shape. But
the heart shape.
The heart shape,
and
that's honestly like my favorite technique now. Like I loved how they looked before, but I just like the way it looks better with my face shape now. And when I line them too, like you can really tell when I have makeup on, but it's just my favorite technique. And the Revance filler, which is our newest line of fillers that we have, is by far my favorite, for sure.
Yeah, and everybody does have a I think with the RHA, which is the Revance. Revance. The Revance.
I want to call it Revance, but I always forget it's Revance.
It is, but I always named it. I have to call it Revance. It just sounds so
we started calling it that from
we started from the very beginning. This is Revance. It's France, so it should be Revance. But it is a softer, more pliable hyaluronic acid that does have movement to it. So we get a lot of patients that really like that filler. But then we still get our patients that really love our Juvederm. They want those Juvederm points. And so, the nice thing is we have the whole selection.
And I noticed for me personally, I feel like the Revance, it lasts a little bit longer for me than like the Juvederm Volbella, which is what I was getting before. I realized this is a little bit longer lasting. Everyone's different, the way like your filler will dissipate on you, but I noticed this is a better one for me.
And then I've had other patients that have said that the Juvederm lasts longer for me. So it really is a personal thing until you experience them. You're not going to know, and they do have nuances that are a little different. And I will have to tell you that putting in filler does have a technique. There is a technique, and it's not as easy as you think. So it's very technique driven. So wherever you choose to get your filler, just make sure that they're experienced and they didn't take the weekend course.
We're certified plastic surgeons.
Yeah, because some things that just can go wrong with filler if you go to somebody, whoever that isn't experienced, doesn't know what they're doing. You can, with filler, block up an artery, and then you can have some necrosis if you don't know what you're doing. So, you block off the blood flow to an area. That's obviously very bad, worst case scenario.
Dying tissue.
Yep, so that section of tissue dies. Some people that don't know what they're doing, too, they inject it outside of the vermilion border, that line that we talked about, and that just looks terrible, because you can see that it's filler, whereas you know, if you know what you're doing, it looks beautiful, it looks natural. But if you go to, you know, that just looks bad. And then there was one other thing I wanted to say that I've seen, like, a common error. The artery, the outside the vermilion border, I don't know. It'll come in.
But
Those are
within 10 minutes.
the
We'll
main
jump in.
two things that can, if you go to somebody inexperienced or who doesn't know what they're doing, that
Right. So I do want to clarify
Yeah.
one thing. When Marley said outside the vermilion border, what she's referring to when you're trying to enhance the volume, because we do inject outside the vermilion border for other
For those
reasons, for the lines.
Yes.
You know, if you have lines that are, you know, driving up
lines.
there, so
Right.
we are going to inject outside this vermilion border. So I want to
Right,
just clarify
yes,
that
yeah,
when
I
you're
meant for
talking about
augmentation
right. So if you're
purposes.
trying to get it here to make it
The
your lip
lip
look
fuller,
fatter,
right.
it's just
Yeah.
not an attractive thing
Yeah.
to do. Again, but I have seen patients that demand that kind of stuff, and you know that they like it that way. So I've seen the gamut over it. So it's a
Yeah.
personal preference.
Right.
But the good thing is that you know you need to discuss, whomever is doing your filler, discuss with them what your real goals are, and hopefully they're on the same page that you are, and that you get the achievement that you did. And,
Realistic goals too.
Right.
Right.
I mean, if you have a very pencil line lip, I mean, we've all seen some women that really have like barely no lip, and they really got a very long area here. That's going to lead me into something that we recommend: not filling the lip, or at least not filling the lip until they have a surgical lip lift. In this opinion, when you've got a very long frenulum here, that you really want to, we make an incision underneath the nose, and it actually lifts up the lip, so you're going to get some more of the volume of the lip and put that vermilion border in a better position. Even though you'll still have a small lip, it'll be up higher, you'll see a little bit more of the teeth, which is natural. And then at that point, if you still want a bigger lip or a fuller lip, then you can inject after that. But there are some times, you know, I'll say don't go with the filler, because if you have that type of lip, you're going to get a lot of that filler outside the vermilion border, what she was talking about, and you look kind of like you have a monkey lip. It's a very stiff lip that really doesn't curl and doesn't show the dark part of the lip that you're wanting to see. That's what makes your lips look full, or makes you look like you have lips. You don't want your lips starting up here.
Right.
So that's something that we can do as well. So that's one of the surgical type of lift lips. The lift lip is that. One of the other things that we can do when we're talking about surgery, when your lips are not aligned, you're either aging or you just weren't born with those kind of lips, it's called a grin lift. So we don't do a lot of this, but for some people whose corners of their mouth are really turning downward, and even if you put filler up here to lift them, they'll get too fat through here to get this. They'll still have turned down corners. This is the one time where what we do is called a grin lift. And what we do is we do a surgical excision on the outside corner of the lip, and we make a triangular cut. So what it does is it surgically lifts the lip. So you don't want to do that unless you have to, because you know you're going to have a little scar here, and it's right on the lip. But we again try to keep it where the vermilion border is, so that if you have any discoloration or you have you know, a little bit of scarring, it's kind of hidden right in that place. And it really is the best way in which to turn up the edges of the mouth. Trying to turn them up with filler makes them look funny, and it makes it feel weird, and people can't talk. So sometimes you have to make that trade-off choice. It's not always, neither one is the perfect correction, but we're looking for that. So those are the surgical types of lip lifts, or you know, changes in the lip. There is another one that we don't do that often, but we did it in the early days before fillers became very popular. And what we can do is do like a little tissue rearrangement underneath the lip and cross over, so you're getting a permanent volume enhancer. But it does take that, it really does make a lip flip, so it turns it up and it's permanent. The thing that I found a little tough with that one, the patients that we did do that on, it takes them a little while to get their speech corrected, because all of a sudden it's like you have cotton like sticking in your lip and trying to form your lip. that was a little bit difficult for them. But honestly, I've seen some of those patients that we did that on years ago, and their lips are beautiful and they speak perfectly fine. But it took them, 6 months or whatever to really get there,
like when you're
to be
dental
to
work
like if you've had some
anything.
major dental work and you can't speak or you have
That's how
that
it was after
filler.
my chin implant. I couldn't talk right for like a couple weeks.
Yeah, so sometimes there are some challenges that people have to be aware of when they are choosing any of these different situations.
The grin lift that you were speaking of, since I've been here, I've seen mainly males have that done, and that works so well. The couple of people that we've done that to, so just throwing it out there that males can have these things done.
Well,
as well,
that's a good one for men
Mm-hmm.
because their mouths might be turning down and they really don't want to be feminine, have a big fat, big plump lip or anything. They don't want that, but they don't want to look like they're sad. It's because it does.
Too.
And so, which is very interesting, and I think that's a great thing. One of the other permanent ways to get lip augmentation, because basically we're talking about augmentation when we're talking about fillers, there are silicone implants that we do. I think they're fabulous. In the old days, don't let that get confused with silicone in the lip, because we don't want to inject silicone in the lip.
Yeah.
So these are soft, medical grade perma filler that are actual lip implants. I've seen them with multiple patients. They are fabulous. They're not overly large, even though they come in small, medium, large. We always recommend the large because it really isn't that much volume. It gives somebody that permanent look that they're looking for, and they love them. They're very pliable. They don't have to get used to speaking with them. I mean, the first days or two you do because you've got numbing on the lip, but they are awesome, the lip implants, and they're called Permalips. So if anybody's Googling them, you can see Permalips is the name of the brand that we use for implants, and they're a great alternative because once you start really loving lip filler and you choose that this is your passion, you think about every 6 months really. A hyaluronic acid filler runs from $500 to about $750 depending on which filler that you're going to get. But if you choose that every 6 months, it starts to add up. And then the aggravation of getting them injected, it's not always pleasant. We can lidocaine the lips. Sometimes what we do is we lidocaine, we numb them first before we inject them, but that was with the cream. And the old days, sometimes they want to inject lidocaine. I don't recommend that because you're changing the shape, and you really don't, then the injector doesn't know exactly what they're doing, so you really want to just make sure that you've only got the topical anesthetic when you're doing that.
In my personal experience, it's very comfortable. I barely feel anything. I just feel the pressure. The only time you can kind of feel a little bit is right around top of your lip right here. I feel a tiny pinch, but it's very tolerable. It's worth it for me. Definitely.
So we know that Ashley loves her lips.
Yes, she does. Yes, she does.
One of her things, that's right.
I know a good place.
It's always a benefit of working here. Does anybody have anything else to add about fillers and lip plumping and the lines around the lip when we're talking about cosmetic procedures? We're going to talk about a couple of other things.
They could get their lips tattooed also.
Well, that's what we're going to go into next. So I just wanted to just end if anybody has anything with filler or anything that they wanted to add.
Not with filler, but about the lip plumper. So one thing that I like about this is with it has hyaluronic acid in it. So basically, for your lip filler people who like to kind of wait in between appointments, this honestly gets me through maybe a month or two longer because it has biomimetic technology with the hyaluronic, where if you apply it every day, your lips will start to build a little bit of that hyaluronic acid in them and it will kind of keep them plumper a little bit longer.
And
that's what I've noticed. And your water, stay hydrated.
That's always really good to know. And before we get on to those other things, because it kind of ties it in, it just reminded me, we have there are great makeups and things that you can do and learn techniques to make your lips look more voluminous. Makeup is a personal opinion on how things are done. This is my personal way. There are ways in which to enhance, but one thing I always try to recommend, make sure that whatever, get a friend's opinion on it, because sometimes you might think it looks good and then from afar it doesn't. If you're really painting lines way outside your vermilion border, I always try to tell women when you're going outside the vermilion border, always make sure you're catching your vermilion.
Right.
Don't make an entire clown line around the mouth because it's visible and it really isn't attractive.
Yeah.
Right.
You might think it is for the hot second that you're looking in the mirror, but as that starts to wear, it's not
Right.
very attractive. And the other thing is that try to keep, in the old days, like in the 80s and 90s, we all outlined our lips, and the lip liner was always a different color than a
Right.
lip. That's
Yeah.
really
A
not
little
trendy.
darker,
We,
It's
yeah.
we want
coming
to
back
make
a little
sure
bit, though.
that
Yeah.
you still look very, it still blends. Your lips actually look fuller and more natural if you've got the same lip shade.
Yeah.
So if you're going to do whatever you think is trendy and you're going to go with a different color, get it as close to whatever the color. Don't make it a totally opposite end of the spectrum.
And
My
speaking-
personal opinion.
Speaking of makeup too, I noticed one way you can kind of like play with your lip shape, and this is actually really flattering for that Russian doll technique. What you could do to really enhance that shape is, even if you don't have filler, if you know how to contour and highlight your lips the right way. So I always take a darker shade and just kind of shadow underneath so that it enhances the middle. And then I take concealer and just to clean up, because I'm not the neatest at applying lip liner on myself. I got a shaky hand. So I just take a long little concealer brush and I just conceal the corners here, and that really rounds that out and really enhances the shape. Plus it cleans up your shakiness.
There you go. But there are different things that you can do without doing surgical intervention to get a more attractive lip, because lips are youthful and
Right.
they're attractive. So, but that being said, now and the makeup transitions into what Lori just brought up, because we're going to talk about lip tattooing. One thing we do, Lauren does our lip tattooing here. That's a part of our subsidiary part that we're affiliated with in the business. But you can get your lips tattooed. So I specifically do not have any makeup on my lips or anything, so my lips are tattooed. I love it because it's just
looks
soft.
awesome.
It's not.
Yeah.
It's not like you're not going to get red lips from
Right,
tattooing. So
right.
that's a mistake. But as you age, and of course I'm in that category, your lips do tend to lose color.
Right.
And if you've ever noticed older women, that's one of the things that happens with them. And what it does is it just, even if you're putting red, because they look very garish the first couple of days, so
Yeah,
don't plan on going anywhere, and they're out to here, you look like Donald Duck, but all of a sudden all of a sudden they get very natural looking. So I'm a real proponent of them, and honestly, I didn't put any like Vaseline or Aquaphor on my lips before, because that's really all I have to do, and it enhances the color.
Yes.
But I didn't do that beforehand because I just came from lunch.
Yeah.
I wasn't thinking I should be doing something with the lips. But tattooing is very,
Yeah.
very. I think it's a great adjunct to
Right.
doing
And some
lips.
people just have like colored lips, even
Right.
if they're young. So you might have a nice shape to your lips, and they might be full, but you can't really see them, especially at a distance, because they're so light. So this is a good
That's
option.
me. I gotta get mine tattooed soon.
And
Mine are the color of my skin.
the one thing I know that you do have to have regular color boosts, and the lip color is the part of the face of the tattooing that stays the least. So it is
Right.
something that you have to do them once a year at
Right.
least
Right.
to keep the color going. I know I'm due. I've had it done both ways now. The great thing about having Marley here is that she surgically numbs you, so
Yes.
you're getting injected if
Yes.
you choose to have that.
Thing.
And you can be very
That would be
comfortable,
tough.
because let me tell you something,
About it.
especially when you have big lips,
Oh.
I'm on the table for a very long time and it is not pleasant, and I can tolerate a lot, and that's pretty bitey.
Yeah.
But now, when I had mine, had the Novocaine to them, and it's amazing.
Yeah.
We went boom, boom, boom. Lauren was able to go through much more quickly, and I got a much more even result because
you were more comfortable then.
Yeah,
So
yeah.
you were
Yeah,
flinching
comfortable.
And we
wiggling
do
it.
like a dental block technique. So because before we mentioned about injecting that it distorts the shape of the lips, but we're injecting it into nerves, so that way it's not directly being infiltrated right into the lip. So it's not messing
Right.
with the shape of your lip, so it doesn't interfere with her tattooing.
Yeah, correct.
So
Correct.
Mhm.
Anything else on the lip tattooing? So I think the final thing I wanted to say about the lips, and I'm really pleasantly surprised. I really thought this was going to be a 10-minute round table.
Right. Oh,
We're half an hour on lips already. I didn't even realize that we could do so much on the lips. So I guess of all the times that Ronnie and Derek are here, it's probably a good thing we're just not talking about lips that they're not here. Although I have to say, Derek has the most beautiful lips. He's He has literal red lips.
Yeah, he does.
And
Beautiful
you know, he'll
shade.
complain about them. I
Yeah.
said, don't complain about them.
Right.
They are absolutely
I
great
would kill
lips.
for lips that red.
Yes.
I got naked lips.
Yeah, they're really beautiful.
Right.
So
Yeah.
Derek, wherever you are, you do have great lips. But finally, and this is where I'm going to kick this over to Lori, and Ashley can chime in here too, because they do the hair removal laser. But one of the things that women suffer from sometimes, if they have any additional hair that's above the lip and something that they want to keep clean and neat, but we have hair removal, laser tattooing, and that's probably the most common area is the upper lip.
Right.
I think when women are working on the face. So I'm going to throw this to Lori now.
Okay, yes. So you want your lips to look beautiful, but you also, a lot of women will get like hair on the top lip that's a little bit darker, and it's embarrassing. So you can get that hair removed with laser.
Right.
Laser hair removal. And it takes probably like 6 treatments, as we said before, same as any body part, at least 6 treatments or more, depending on how your hair grows.
Can you do electrolysis?
You could also
Or-
do electrolysis.
So you could do either one, laser hair or.
Well, they say it's probably a little quicker with the laser hair removal because we have it's a light-based
So if you're-
laser we have, so it hits
Yeah.
more of the
So
lip at
If
once.
it's dark.
If your
So
hair is
that's
dark.
that's the key.
If it's
that's
lighter.
the choice.
Yeah, right.
But we have both because Suzanne
Right.
does our
Yeah.
electrolysis. So
Right.
kudos to Suzanne. But one of the best things that I've seen, if you are not a candidate to be treated
with the laser.
with the laser, that's
If
going to be
you're
your
light.
first choice
Right.
because it's faster, it's quicker,
Right.
it's more. It's longer lasting, but then we put you over into the
Electrolysis
electrolysis.
Yeah.
if you
If
have
you
like
have some
lighter
gray,
hair,
gray or
right.
blonde,
Right.
if it's
Yeah.
blonde,
Yeah,
because
because if you
can
have dark hair that's thick, you're a perfect candidate for laser hair removal.
Yes.
But unfortunately, I've had a lot of
Like
clients
the
and
blondes,
patients.
the
They were
reds,
blonde,
so
gray hair,
gray,
those
yeah.
stubborn whiskers as they call them.
Yeah.
And they
Whiskers.
can't-
Yeah.
I-
Their
and you
electrolysis
can't
is
get
perfect.
them off. Electrolysis is
It
perfect
is.
because you could. It's like Lori said, it's light-based therapy, so that diode's going after pigment. It's not seeing blonde hair, red hair,
Right.
gray, or white. It's just seeing that dark hair. So if you suffer from whiskers, electrolysis is perfect for you. We have it all
Yes.
here. So
Yes.
if your lip hair is waving at you, come see us.
What a way to end that. I'm going to end that a little differently. But before we call it a day, does anybody else have anything to add about lips?
Well, even with fine lines and wrinkles, we can also laser those.
Oh, how do we
Yeah.
forget
I
laser?
don't know. I don't know how, but yes, you
Yeah.
can get the laser treatment on your lips to help with those.
We didn't.
I mean,
we
there's-
didn't
Yeah.
talk about permanent addressing the lines that around the mouth
Right.
of the aging.
Right.
So as Lori said, we can address them with laser.
Right.
We can also address them with surgical dermabrasion if they're really very,
Yes.
very severe. That's surgical dermabrasion, believe it or not, even though we have an arsenal of lasers, and I love lasers.
Yes,
you know,
I do too.
love lasers. But I will have to tell you, that area, if your
It's tough.
lines are really bad,
Yeah.
the best thing you could do is surgical dermabrasion,
Right.
and it's actually cheaper in the long run than laser too. So,
Yeah.
I don't want to leave without mentioning that as well. So
Yeah.
that's a key thing. So great about the permanent
Yes.
addressing those
Yes.
lines. That's why I always have to ask you. To
Yeah.
do that. I have my outline,
Right.
but sometimes I forget.
Yeah.
We get unattended But anyway, and I think I'm going to speak for Sarah. I think the one thing she wants to add before we sign off is that her lips are great for kissing her little Luca. And he's just a
he's
cutie
so
pie. I know.
Yes.
She's using her lips a lot for all that
Yes.
kissing.
Yes.
And I think on that note, that's how we want to make our lips beautiful
Right.
for more than just kissing because you're Irish, But I think that's how we want to end that segment. And I want to talk about what we're going to do next time. So at our next roundtable, we're really going to have a very hot topic, and this is really near and dear to Derek's heart as well. He wants to talk about hyperhidrosis.
Right.
And hyperhidrosis is extreme sweating. And
Right.
we're not talking just about armpits,
your
we're talking about hands,
hands.
feet, other parts of the body where you've got some increased sweating and glands and things like that. So it's going to be a hot topic. So
Yes.
if that's something that you're interested in, stay tuned because we're going to have a lot of information on that. And till then, keep kissing your Irish. We've got till the 17th.
Yes.
Wear your cream.
Yes.
That's it.
Thank you.
Bye, everyone.
Bye.
Have a great day.